Chinese health authorities are still working to identify the virus.
कोरोना वायरस की वजह से खो दिया.
普通话语言社区了解政
Covid-19 tidak akan hilang dan penduduk dunia perlu terima hakikat.
Partially ban travel from China, infection levels start to explode all over the world.
COVID-19 has affected a lot of people around the world. It is all started in the capital of Hubei province in the People's Republic of China named Wuhan. In 31st of December 2019, Wuhan Municipal Health Commission China has reported a cluster of cases of pneumonia in Wuhan. A novel coronavirus was eventually identified. In January 4, 2020, WHO reported that there was a cluster of pneumonia cases with no death in Wuhan.
Strong actions here
Deeply
to try to
concerned
move
both by the
to
alarming
contain this,
levels
to be
of spread
testing.
and severity, WHO made the assessment that COVID-19 can be categorized as a pandemic in 11 March 2020.
As a pandemic.
In Malaysia, the first cases were confirmed in 25th of January 2020. This involved 3 Chinese citizens who had entered Malaysia via Johor from Singapore on 23rd of January 2020. Until this day, Malaysia is still bombarded with hundreds to thousands cases and multiple deaths reported in a month.
This is SARS-CoV-2. It belongs to the family of coronavirus named for its crown-like spike on their surface. SARS-CoV-2 is the virus that causes COVID-19 that attack primarily your throat and lungs. The coronavirus must infect living cells in order to reproduce. Microscopically, inside the virus, there are genetic materials containing the information to make more copies of itself. According to WHO, these are the symptoms if you contract with the coronavirus. The most common symptom of COVID-19 disease is fever, dry cough, and fatigue. The other symptoms that are less common and probably affect some patients include loss of taste or smell, nasal congestion, conjunctivitis, headache, muscle or joint pain, different type of skin rash, nausea or vomiting, diarrhea, chills, and dizziness. Patients who infected by severe COVID-19 disease most likely to experience shortness of breath, loss of appetite, confusing persistent pain or pressure in the chest, and high body temperature reaching to 38 degrees Celsius. The less common symptoms for severe COVID-19 disease showed by the patient are reduced consciousness and sometimes associated with seizure, anxiety, and depression. The most severe and rare neurological complications such as stroke, brain inflammation, delirium, and nerve damage.
This pandemic gives heavy impacts to millions of people, starting from health, social life, and economy. Sometimes people who are affected from the disease are either die or live with risk. The extensive precautions must be taken, such as good hygiene, like always washing hands or using sanitizer, quarantine, social distancing, and always wearing the mask in the public. The afraid of the spread of the disease lead to many countries controlling and banning people from entering or exiting their country. As example, Malaysia restricts any movement and gathering nationwide, that is known as MCO or Movement Control Order. This restriction unfortunately separated many families, friends, teachers, and students from meeting each other. However, these heavily strict enforcement are a must to stabilize the world again. Lastly, many manufacturing companies were closed during the enforcement. People had to take a break from their work or quit the job. The economy of the country also plummeted, and are highly risk to fall into poverty. As a human that have empathy and sympathy, we should take care of each other, follow the rules and keep hygiene. If we have the symptom, go to the hospital immediately.
Due to the rapid increase of positive COVID-19 cases in Malaysia and with the first 2 deaths reported in mid-March 2020, the government took many steps to alleviate the mass panic and protect the health of Malaysian citizens. Among the earliest efforts taken by the Ministry of Health to prevent disease transmission was the enforcement of health screening at all points of entry and isolation in special quarantine areas for COVID-19 cases amongst tourists and locals returning from abroad. The subsequent key step taken was to increase the number of hospitals that could treat COVID-19 cases. There was also a group effort between public and private hospitals to accommodate the growing numbers of cases of infection, comprising university hospitals and Ministry of Defence hospitals. Last but not least, to enhance the Ministry of Health efforts in keeping the spread and mortality under control, a Movement Control Order (MCO) was implemented on March 18, 2020. The MCO related to the restriction of movement of people into or out of an area. Other restrictions imposed included prohibition of mass gatherings and closure of all facilities except primaries and essential services such as health services, water, electricity, telecommunication and food supply companies.
Makanan ke rumah iaitu grab food.